let's say hepatobiliary surgeons decide on the hashtag hepatobil. What they can do is send out tweets with this hashtag, so everybody within this group of surgeons receives these tweets and know what to do. Because truly, walking around these yesterday, I was completely lost. It would have helped to know where a pediatric surgical stand is, where a pediatric surgical talk is going on. So this is one way to organize conferences to suit one's needs. And it doesn't hurt to use Twitter to make the conference experience a little more pleasant. Twitter can be used to help residents study. In my mind, I have a thought of using Twitter for resident education. For example, once a week I can tweet out a board types question and then link it to a discussion on my blog. I would benefit from researching the subject, and then others who follow my blog and Twitter account will benefit from looking at these answers, and then the ability to discuss and post answers on the blog. For example, here, I hashtag this P site for the pediatric surgery in training exam and in-service exam. The hashtag here would take you to the blog, and this is the question. So you can, once a week, in a continuous fashion, get exposure to board type questions. As you all know, the American Board of Surgery Maintenance of Certification program includes requirements for 50 hours of continuous medical education to 3-year cycle. Another way Twitter can be used is surgeons tweet out directions or information about sites that give CME credits particular to their field of interest. So here are some examples of how this works. So let's say we're following GlipClap, which is our Twitterer, who posted something about bilious emesis in infants and neonates. He added 2 hashtags so that if you're a pediatric surgeon or somebody interested in pediatric surgery or surgery in general, you can access this tweet. And he put in a shortened URL, which if you are interested about more details regarding the subject, you hit the URL and it takes you to a blog. And here, for example, I discussed bilious emesis in newborns. So for people who are not familiar with what a blog is, it's basically an online journal. So in this blog, for example, my blog is Pediatric Surgery Zone. I posted a discussion about how often surgical process is involved in emesis in newborns. Body of my blog, and because this is a relatively scientific blog, I hope, there's a reference at the bottom where I got the information from. The nice thing about blogs is you can label them. So I put the label here. I don't think you can see that well, but basically it's neonate and GI. This automatically indexes these subjects up here, so you can easily retrieve them later. So blogs can be a huge resource in surgical education and can complement more traditional ways and didactic ways of learning. And the nice thing about these blogs is that each one has its own URL, which is its own address on the internet. So I can easily take the address of this blog and insert it in any other communication. And the people, all they have to do is hit that URL link and they'll take them to this blog. And really, healthcare workers have been using blogs much more frequently now because there are very powerful sources for exchange information where followers can actually comment on these blogs and discuss their contents. Another example, let's say you're following me on Twitter and you're a pediatric surgeon who does laparoscopic polymyotomies. You would know that arthroscopy knives are out of production, and maybe you'd be interested in how a Rovi can be used for this process. Hit the URL link and it takes you to a YouTube video. Please excuse the sideways video. We had some serious problems in the tech area downstairs. So, very seamless, very smooth. And YouTube is another very useful resource. If you go onto YouTube site and you search for laparoscopic surgery, you will find more than 4,000 hits. And I'm sure, as you would expect, the majority of these are just useless videos. But in this case, surgeons within a network who come across a useful YouTube video can share it with others. And this way they can combine their efforts so that others don't have to go through the same process of sifting through all these videos and figuring out which ones are good or bad. So it's very important in organizing web content. In conclusion, somebody once compared trying to get information from the internet to trying to drink from a fire hydrant. And Twitter can be used by surgeons to organize this massive information on the internet, share what's relevant, and then enrich it with their own thoughts and experiences. So, can Twitter make you dumber or smarter? It really all depends on how you decide to use it. Thank you.
Thank you, Sonny. So, moving on with our panel now. When I was putting the panel together, it became very clear to me that we needed to include a patient advocate in this because our patients are really part of this dynamic that's getting social media to our attention. I found Susanna Fox in the blogosphere, actually. We met online. I sent her an email. She sent me back an email. We shared a telephone call. And I have really, she's made me think a lot in the last 6 months that we've been putting this together. Let me just give you an example. She is an anthropologist with her undergraduate degree, and so she thinks like an anthropologist. And so she was asking me last week what the audience was going to be like. And I told her it was no civilians, surgeons only. And she said, well, how do surgeons think? And I said, well, I referred her to the book Forgive and Remember, because that was a book that I had read during my residency that had sort of made me start to think more like a surgeon. And she tweeted me back. She said, well, how are patients included in this book? And they're not. And I think it's something that we talk a lot about including patients in our bedside relationships with them. But I think social media is actually making us think more and more about how we relate to our patients, what they're thinking about, what their feelings are, and what their families are thinking about. So I'd like to introduce Susanna Fox, who is the Associate Director at the Pew Research Center in Internet and American Life. She is paid by the Pew Charitable Trust to examine the social impact of the Internet. She is a critical thinker, and I think she's really going to enlighten us. Susanna.
Thank you very much. I was told I had to put this disclosure slide, and I'm probably the person least likely in the room to need to do any disclosures, so, but I'm glad it's there. So let me tell you a little bit about the Pew Internet Project while you start to decipher the first slide. We are funded by the Pew Charitable Trust to study the social impact of the Internet. Most of our research is based on telephone surveys, and the research that we do about health and healthcare, it's now essential that we include mobile phones. So when you get when you get a survey call on your mobile phone, as 80% of you now have mobile phones, please take the call and participate in the survey. And we also now, through the funding of the California Healthcare Foundation, are able to have Spanish language interviews. So what we do is try to provide data about what people are doing online, who's online and who's not online, and what the impact is on our society. One thing that you'll notice about this first slide is the lowest line, the 65+ group. And that's often something that people talk about, that people who are most in need of medical care, our population that is most hit by chronic illness is our older population, and they are less likely to be online, but their loved ones are online. And what we find in our surveys is that half of health searches are conducted on behalf of someone else, not the person sitting at the keyboard. Another trend that is very important to remember as we talk about social media and the use of video especially is that broadband is now an assumption in this country. About 2/3 of American households have broadband. And actually, I'd be curious, how many people in the room have broadband at home? And that's exactly what I would predict. Let the record show it was almost 100%, probably 100%. Broadband is associated with higher education and higher income. And what we find is that as broadband has rolled out, people have become more social. People are more likely to watch videos, to participate. A dial-up user takes part in 3 activities per day, whereas a broadband user takes part in 7. The other broad trend that is really changing things, and this is for, by the way, for all American adults, no matter what the education level or what your profession is, mobile is changing us as internet users. It is making people more likely to share online. So I actually think that this year is the perfect year for ACS to have a panel about social media, because we are actually seeing mobile spreading throughout the population and changing our attitudes. Information is now becoming portable, personalized, and participatory. So it is definitely not too late to talk about how surgeons, how doctors, how everyone can benefit from this new wave, from this change from the internet as this stationary information vending machine that we all knew in the late 90s, to this portable and this portable communications device that we all can have in our pockets if we need it. Now, indeed, I do often talk about the consumer angle, and I should quickly say that I'm actually not a consumer advocate. I study consumers. Frankly, we can get consumers on the phone. I've heard that if I want to survey doctors, that you all would actually ask for $100 per respondent. So I don't have that kind of budget, so I'm just going to stick to the consumers. But I think some of the trends that I'm seeing in terms of my research, looking at consumers, can translate into what we're talking about today. What we're seeing is that mobile makes someone more likely to gather information online, to share it, and create information. And so I wanted to give you some background. I actually just came out of the field with our latest survey, and it's looking at, again, how many people use the internet for health information. What we find is that 3/4 of American adults have internet access. 80% of American adults look online for health information. 56% of internet users look for information about a certain medical treatment or procedure. 44% look for information about doctors. People are doing their research. People are preparing for doctor's appointments and, frankly, recovering from doctor's appointments by going online. 62% of American adults now use social network services, and 1 in 4 use Twitter. So if the ACS survey is right, you guys are actually even further behind than what we thought. Currently, 1 in 4 Americans use Twitter. Now, something to remember, going back to that first slide, which showed lower adoption among older adults. There's also lower internet adoption among people living with chronic disease. But what's really interesting to me is that if someone living with chronic disease goes online, they're actually more likely to participate in the conversation about health and healthcare. So when they have something at stake, they're more likely to participate. And I think that translates actually to what we're talking about today. You have something at stake too. And so I'm going to talk about how doctors can gather, share, and create information online. So in terms of gathering information, I think Sonny gave a great presentation. I personally find that social media is a filter in my work as an internet researcher.